Hello, and thank you for joining me. My name is Clayton Andrews. I am a sickle cell patient and advocate. I'm a 37-year-old father of four that resides in Savannah, Georgia. I'm a licensed professional counselor and a clinical supervisor with Spectrum Health Services at the Georgia State Prison. I am also a wellness recovery action plan certified as well, or RAP. Today, I am presenting to you the Sickle Cell Mental Health Initiative proposal for the 2020 and 2021 year. Thank you for joining me. The Sickle Cell Mental Health Initiative was put together for the needs of those patients dealing with mental health and sickle cell ailments. The physical and social consequences experienced with sickle cell disease, those pain crises, lower hemoglobin, treatment response, lethargy, employment, those issues correlated highly with the emotional consequences also dealt with, such as depression, anger, anxiety. With that in mind, the Sickle Cell Mental Health Initiative was brought into action. As requested by the warrior community, we launched the Mental Health Initiative. The Sickle Cell Mental Health Initiative was created by the warriors, caregivers, and providers of the Sickle Cell Community Consortium. In active work in progress, this platform identified patient, caregiver-centered focus and priority during the 2016 Leadership Summit and General Assembly of Patients, Caregivers, and CBOs. The platform addresses the patient-caregiver identified mental health needs and concerns. The team is also driven to working to curate existing mental health resources, identifying any gaps from the patient-caregiver perspective, and also those barriers to access to mental health care. The formula of this initiative is derived from addressing the acute mental health needs of our community while also maintaining a long-term platform. This initiative was created by the warriors, caregivers, and providers of the Sickle Cell Community Consortium. Mental health identified as a patient caregiver center of focus during 2016's Leadership Summit. The team placed focus on the recent need for acute grief and the necessity for counseling. The Mental Health Initiative will develop a platform that supports bereavement in the future. This will be done potentially with peer-to-peer training for support. Additionally, the team placing priority on developing partnerships with different groups and entities to build networks that address the many mental health needs that arise. The development of a protocol for acute needs was presented with the notion providing the following in online sessions, telephone conference calls, Facebook Live presentations, and web platforms. The community's response to our team's plan has been encouraging. Many members of the community have expressed the mental and emotional trauma often unassociated and accounted for the duration and aftermath of a sickle cell pain crisis. The additional everyday psychological trauma that run parallel to those consequences oftentimes are ignored. We will work to provide education and developing a campaign focused on destigmatizing mental health in minority communities by utilizing 4 pillars of focus. Pillars 1 and 2 will focus on education and curating resources, i.e. through Warrior University, in-person sessions once available again, printed publications, identifying resource gaps, and online resources through a resource clearinghouse. Pillars 3 and 4 will focus on training and outreach. We will look at an ongoing venture in training the community, seeking to help our community to help one another, as well as working on in-person workshops when the time is appropriate, and retreats or boot camp symposiums also, again, when the time is appropriate. This initiative is meant to be a safe space. Every member of the sickle cell community is welcome here. This group was founded as part of the mental health initiative by the patients and caregivers of the Sickle Cell Community Consortium, and as a place to openly discuss the mental health concerns stricken with our patients and warriors. We are joined by mental health professionals who will help us to navigate through this journey on our way to healing and wholeness. We placed our focus last year in educating the sickle cell community on highlighting emotional and spiritual well-being. In 2019, as the sickle cell community continued to pursue a more grounded focus on the mental health of the warrior, emotional and spiritual facets of mental health came into play. The initiative dedicated 2020 in educating, encouraging, and empowering the mental, spiritual, and emotional health of the sickle cell warrior, caregiver, friends, and loved ones. Some of the areas that we covered in 2019 involved sickle cell and grief, dealing with grief and loss, clarity of mind and major depressive disorder, looking at anxiety and post-traumatic stress, caregiving for the long haul, managing mental and emotional health, warrior mental health, spiritual and emotional well-being, and a wellness plan workshop. The unexpected complexities involving the COVID-19 pandemic currently going on, significant changes were made in our planning in reference to 2020 as well as 2021. Some of those changes included developing a mental health support COVID-19 webinar series that was held in April and May of 2020. Also, the team has been looking at organizational restructuring as it pertains to the initiative in our work. We are also working on planning retreats and workshops, as well as the continued functioning of the webinar series. All sickle cell warriors, caregivers, CBOs, and mental health providers and experts are invited to join us as we navigate the battlefield of the warrior mind. An open discussion on mental health topics chosen by the warrior community will be hosted live on WebEx every first and third Tuesday of each month at 7 p.m. Eastern Standard Time. As we have all faced at some point in our lives some stress, trauma, anxiety, or anguish, we've all been there, and we all have that thing in common. It is time for us now to be able to be open with each other and talk about it. Please join us as we help to support one another. Thank you so much for your time, and have a good day.